I actually grew up in Bradenton, Florida, so quite a ways away from South Dakota, but I got recruited to play college volleyball up in Aberdeen at Northern State University, where I got my undergraduate degree. And then I stayed here at the University of South Dakota for medical school and completed medical school here, and then went on to complete my residency training at the University of Oklahoma in Oklahoma City. My mom was a NICU nurse, so I grew up my whole life around my mom taking care of these tiny babies, and I was fascinated kind of by the world of medicine. And so from an early age, I had a passion and wanted to pursue becoming a doctor. I think that, what really drew me to OBGYN was the fact that you get great continuity with care, not only throughout a pregnancy, but also throughout a lifetime. You get to work with teenagers to women who are, navigating reproduction and having children, infertility, all of those challenges, but also perimenopause and menopausal care. And so really you get to walk through life with your patients and develop relationships with them over time. You may not be addressing the same thing over time, but you can really take care of patients throughout their lifetime. The first visit, I really like it to be, where they're telling me, first and foremost, whatever biases or things they're worried about coming in, so we can kind of meet each other, kind of knowing what their fears are about the appointment. And then I want to get to know them and their goals of seeing me, so that way we can focus on the right things instead of, getting lost in kind of some of the weeds. And, while we may not get through everything in that first appointment, I hope we both have talked about the big things they're worried about, so I can, help us go down the path of discovering how we can best serve them in that way. And then, making close follow-up so we can get the full story over time. I actually was lucky enough to be a medical student with the Avera OBGYN group, so I got to learn from people who will now be my partners, and I fell in love with the field here. I love the type of practice they have and the partnership that they have amongst the group, and I quickly, after leaving here to complete my training, which was great, realized how special Sioux Falls is, how special the Avera group is, and how the hospital system as a whole just really cares not only about the patient, but as well as the providers, and I think that makes a really special environment. Right now, the thing I do the most is spending time with my family, including my husband and my baby who's 7 months old, and I also love being active, whether that be, recreational volleyball or working out at home doing Peloton workouts.